This week's Ask Dr. Durie comes from the daughter of a patient who says that her mother has recently been diagnosed with myeloma, but no treatment has been recommended. And the question is, should a bone marrow biopsy be performed? Well, I think the answer to this question is probably yes. And so there may be some confusion about the exact diagnosis. This lady's mother most likely does not have active myeloma, but rather monoclonal gammopathy of undetermined significance, what we call MGUS, or smoldering myeloma, which is why the doctor does not want to treat right away. But it is extremely important to be sure that that is indeed the case, that no treatment is necessary. And so as part of that evaluation, I think it's very, very reasonable to consider this bone marrow biopsy as a baseline to see what is the percentage involvement with myeloma cells in the bone marrow. Is it at that low level that would be consistent with the MGUS or smoldering myeloma, or is it creeping to a higher level where one might need to think about starting therapy? So obviously, if treatment is one of the options, it's not something that should be delayed. Obviously, one doesn't want to take treatment if it's not needed, but on the other hand, if you do need treatment, you want to start before problems emerge. So bottom line in this situation is, if you have a question about the diagnosis or the treatment, get that extra testing just to be sure so that you know, okay, it's safe to follow and monitor without therapy, or maybe treatment is required, some extra scans, imaging are needed to be sure, something else is needed. Maybe even if there's a doubt, it's a situation where a second expert opinion is required. At the very beginning is when it's most important to get that expert input before you embark on a course of treatment or monitoring, which may not be ideal. And so in this case, probably go ahead with the bone marrow biopsy, but consider some detailed discussion and see if any additional consultation might be needed.